When I was 27, I found what I thought was a lump in my breast, and that was actually the beginning of developing very, very dense breast tissue, and having regular mammograms and, as it turns out, ultrasounds. Then when I was in my late 30s, I started having the mammograms and the ultrasounds every year because I was getting a bit older, and I think they just wanted to keep a bit more of a close eye on me. And in 2002, I went to see my GP, and she did a physical examination on my breast. She picked up that there was a hardness around my right nipple, which, to be honest, I could not feel. To me, it did not feel any different from what the rest of my breast felt like. She referred me to a breast physician for, first of all, to have a mammogram and an ultrasound. When the person who analysed my tests came back and said that there were no problems, I didn't actually go to the referral. We went overseas a couple of months later. When I came home, I was in bed one morning and I turned over and my right breast hit my hand like that. And I thought, that's not normal. I found the letter. I hadn't thrown it away. I had kept it. I rang the breast physician's clinic and I went to see her. And that was when all hell let loose. There was obviously something was wrong that they were picking up that had not been picked up on the tests only 3 months earlier. I was 43 at diagnosis. My tumour was 46 millimetres, so it was a bit of a doozy and it had been there for a while. I actually had a surgical biopsy, and that was what diagnosed it. So all in all, I was actually a very hard diagnosis. I had been having regular mams, regular ultrasounds. I was the wobbly factor in all of that was my breast density. I understood that that was that the problem with that was that it would obscure any potential tumour. I now know from the research that I've read more recently that in fact that level of breast density was actually a risk factor in itself. I was told that I basically had no choice. I was a candidate for a mastectomy. I was recommended to have a reconstruction at the same time, and I did have a tram flap reconstruction, which has been very successful. And I'm actually very pleased I had it. One of the things about a tram flap reconstruction, which I don't remember being told, but I actually make sure I tell other women, is that I still have feeling on the right side of my chest, on my breast, my reconstructed breast, whereas a mastectomy leaves you, I understand, with a numb chest wall. And I quite like being able to know that it's, there. One of the things that the Breast Cancer Foundation does tell you to be aware of is if you notice an increase in your breast size. And I have to admit I missed that one completely. I was diagnosed in February 2003. In February 2002, I bought a new bra, and I actually had to go up a size. I have to admit, my vanity was quite tickled by this because I'd been quite a slow developer, and so I did not pick that up as a warning sign. After being diagnosed and being treated for cancer, and I had a mastectomy and a reconstruction, and I had chemotherapy and I had radiation therapy, I have not had any more root canals, despite having up to half a dozen probably in the 10 years prior to that. And I also stopped having abnormal cervical smears. And I believe myself that if I had put all of those ducks in a row, I'd have picked up, or somebody would have picked up, that my immune system was not coping anymore. I'm at this point an 11-year survivor. So I'm very pleased with my progress.